Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Rovello, and I am here today with Dr. Jay Calvert. How are you?
I am really, really good.
Really good.
You know why I'm really good?
Why are you really good?
Because yesterday I did 14 hours of surgery
Oof,
in one day
that's a lot.
on purpose. and today I did zero.
That's a nice little
and I needed the zero today.
trade.
I was like, I'm not doing much on Wednesday. We could have put one of these huge cases on Wednesday, but no, let's do them all in one day.
That sounds like a Dr. Rovello day.
It is. Oh, I know. When I'm like trying to reach you on Monday and it's like 7 p.m., I was like, I should probably start a third case right about now. I got one more after this too.
Yeah, that bilateral recon starting, right about now.
Didn't you have one yesterday though? It was
Yeah.
like 5 p.m.?
Yeah, I did. Cases have to go.
I think
You gotta
when
go.
you gotta go, you gotta go.
You gotta go.
That's for sure.
So when you do a lot of surgery, lots of hours, lots of cases, there is no way around the fact that you are going to have complications.
If you're operating, you're having
You're
complications.
having complications. And when we go through general surgery training, plastic surgery residency, we have weekly or monthly conferences that we call M&Ms. They are morbidity and mortality conferences where we go through all of the complications, all of the potential deaths that happen that week or that month. And we break them down into what happened, why they happened, and potentially how we can prevent that from happening. So it is ingrained in us as surgeons to be held accountable and to recognize when we have problems so that hopefully in the future we don't. That being said, it is inherent in surgery that you will have complications. And in fact, we would have attendings that would tell us as residents, if you don't have a complication, you are not operating enough. So it just goes without saying that it's going to happen. Now, if you are the patient and it happens to you, it's a much bigger deal because now it's happened to you. And I get that that is incredibly traumatizing. So this podcast is really about what do we do when a complication happens?
And it does happen. And, luckily we only have morbidity conferences in plastic surgery because mortality is like not part of the thing.
Yeah.
But I will tell a story about that from a foreign country that will get people to go, maybe I'll stay in the United States for surgery.
That is
maybe
very
I
true.
will.
Yeah. And, true, we don't have mortality, but every once in a while, random freak things do happen.
They do. And I've been in Beverly Hills now for since 1887, and the truth is that the deaths that happen in plastic surgery are so rare and so extraordinary, and there's always some crazy ass problem that goes along with that death. I can tell you that.
Right.
Most common, cocaine use.
I was just about to say drug use.
It's cocaine, and I didn't tell my doctor, and I'm 62 years old, and I'm having a facelift, and boom, now you're dead. So cocaine and plastic surgery, not a good combination.
Not a good thing. Cocaine in anyone over the age of 40, probably not a good thing.
The
heart just can't take it.
I think the cocaine ever is never good. I don't know if anybody knows it's illegal, by the way. So whatever you think. I did have a patient say that to me, though. I was like, man, your nose had so much scarring in it. What's the deal with that? And he was like, the 80s. I was like,
Got it.
Got it.
That's
Okay. Anyway, the reality is that complications do happen. Hematomas, seromas, wound problems, infections, scarring that's unfavorable, implant malpositions in breast surgery. These things happen. Problems happen, and they are not they're not negligent. They're not malpractice. Mm-hmm. There are problems that occur in the absence of negligence, in the absence of any malpractice that are, and this is something that always comes up. Like, I'll have patients come in and say, like, I'm having a hard time breathing through my nose. I should sue that guy. I'm like, breathing difficulties after a rhinoplasty are a risk of surgery, and we are not able to consent for malpractice. You can't have a consent where you're consenting somebody to a problem that can occur. It's not malpractice. It is simply a sequela and a problem that can occur after surgery.
Right. And I would say in general, most of the time, things
Hang on. Car.
Oh, yeah.
Car. There's a car out there. You hear it?
Yeah, it's
okay, we just got to wait. Wait for him to go by.
There it goes.
It's still going. Hang on a minute. All right, game
now
on.
It's gone. Okay.
All right, game on. Go.
Sorry. Hazard of Santa Monica Boulevard being right outside
Sean will
our
probably
window.
edit that out, and then oftentimes he won't. Just be like, it's part of your podcast. The sirens constantly whizzing past the Beverly Hills Triangle is part of the deal for you guys.
That is true. But yeah, no, going back to the complications. Like we said, happens infrequently, but it does happen. And when it happens to you, it's 100% of the time and it's miserable. So what do? And we're not going to go through every single complication that could possibly happen because there are so many that are potential and there are so many that are common. And then there are the ones that happen randomly that you could never have predicted. And so a lot of times there's just no telling. But when it happens, there are a couple things and a couple steps that you have to go through. The first thing, I think the most important thing in the beginning, stay in contact with your doctor. Go to your follow-ups.
100%.
If something seems strange, abnormal, call the office, call the doctor. Because please, 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 the earlier we can catch these things, a lot of times the better we can treat them.
100%. And you have to speak up. If it doesn't seem right, give us a shout.
Yes.
And don't think like, oh, I don't want to upset them. Like, we're here to we know about complications. We've consented you for surgeries that have inherent risks involved in them, and we are prepared to take care of them so that you can still get a great outcome.
Absolutely. And this is why I have my patients coming back week after week after week. And they're like, well, I live far away and I'm coming from a couple hours. I don't care. That sounds really mean, but I need you here because I am concerned about complications and I need to know that you are doing okay. So I need you to get your 2 hours on the road and come see me because it is important. Like, I want to see you because I want to make sure that everything's going okay. And it's important.
It didn't sound mean at all, but it is like, you have to do this.
Yeah.
And it is again, go back to our, podcast about like post-op instructions. Like, you have to follow the instructions, and part of it's following up because things do occur that we can identify early and head it off at the pass so that it doesn't become a problem. Yeah. But let's say you do a breast augmentation and it's, 2 weeks after and you're vacuuming your house and the breast starts to blow up like a balloon, which has happened, and you're getting a hematoma. You need to call. Don't panic. Do call right away to say, hey, there's something going on. My breast looks like it's twice the size of the other breast. This does happen.
Yep, sure does.
Especially during vacuuming. I find that early vacuuming is a common reason for
mine is
hematomas.
Light housework.
Light
housework.
Light housework.
What are we doing? Just some light housework, some light cleaning.
I think that falls under vacuuming too. It's in there. It's all the same thing.
I know.
Rearranging the furniture has caused a hematoma as well. That in the first post-op week. So try to get this stuff done. Get out of your own way. Don't do it before. Do all that stuff before surgery, and then recover for 3 weeks so that you don't get a hematoma. But should you get one, call us. We will be taking you to the OR to drain that hematoma.
Right, pretty quickly. Now, there are very few things that are true emergencies in plastic surgery. Usually we have a little leeway of time, a couple days, to get you to the OR to address things.
For sure.
So outside of the immediate 24-hour time period where there might be some emergency bleeding, anything that happens after 24-hour window is very rarely an emergency, but still something that should be addressed sooner. So there are some things that do require trips back to the operating room. A hematoma would be one of them. Possible wound dehiscence. I've heard of some patients that had an immediate implant malposition that was noted almost right away. That's an immediate return to the OR. So there are some things that have to happen right away. And then there are some things that we watch. So maybe there's a wound care issue or a mild infection that we're going to treat with some antibiotics. And we're going to follow you on a regular basis. And if it doesn't get better, then maybe we have to go back to the operating room. So these are all things that are possibilities. And I don't want to say worst case scenario is you have to go to the operating room, but that's usually the last step in terms of what we have to do to fix a complication.
Yeah, problems that occur from surgery tend to need surgery to fix them. I mean, it's just, it makes sense, right? You have problems that were induced by incisions and moving tissue or putting in implants, and now you have a seroma. These things need to be handled. It's not a big deal, except it costs money.
Except that it costs money. And that is usually where the most anxiety comes in for patients, because a lot of times these were cases or procedures that were done for cosmetic reasons. And a lot of insurance companies throw up their hands and say, well, that's not an insurance procedure.
You picked it.
We're not paying for it. So now who's on the hook? and it definitely becomes an issue. So in my practice, the way I typically address it is all of my patients get CosmetiSure. That's an insurance specifically for cosmetic procedures, and it's not an option. You can't opt out of it. If you are having a cosmetic surgery, you sign up for that. And then should a complication occur, say you have to go to the ER because we're concerned about a blood clot, or say you do have to get IV antibiotics for an infection, the way it works is your insurance gets billed by any entity that worked on you. If they pay it, fantastic. If they don't pay it, then you take your bills and whatever doesn't get covered and submit it to the CosmetiSure, and then they reimburse you. So it's kind of a long, drawn-out process, and it's not exactly streamlined, but it is the fallback so that you are now not on the hook for that $5,000 ER visit.
Right. And that's an issue, and I like that idea. Is CosmetiSure sponsoring this episode? Because it sounds like they should be. They kind of should be. CosmetiSure. We're available. Give us a call. We'll help. But I agree with your concept of having that for your patients. But the patient pays for that, right? That's a additional charge.
It's a stated fee for depending on the level of the procedure. I think for a breast aug, it's $165. For a tummy tuck or body lift, it's $245, and it's just tacked onto the cost of your procedure. You pay it to us directly, and then everything else is handled on the back end.
I think maybe I should do that for my patients. That sounds pretty reasonable.
It is.
Yeah, I mean, why not?
So what is your methodology then?
Well, I pretty much tell the patients you have to pay for the complications, because we say that I won't charge a surgeon fee, but if there's OR and anesthesia charges, you have to pay those. Yeah. And that is, in fact, when patients come in, they're a little put off by it, but we give them a copy of our revision policy because I do so many rhinoplasties, which carry with it an inherent risk of revision. All comers national average is 15%, and I do 150 to 200 rhinoplasties a year. 15% is a real number of patients that need more surgery. So they're going to have to pay the OR and the anesthesia fees.
Well, I think there's an important distinction to make between the complications that happen in the first 30 days. And so that CosmetiSure covers maybe the first 90 days or something like that. So it's for the immediate complications, infection, bleeding, rule out for blood clots, things like that. But complications that happen 3 months, 6 months, a year, which are just part of the natural healing process, that's a different discussion.
Right. And that's not, those aren't complications. Those are sequela. Those are things that happen. And that's why, again, anybody having revision rhinoplasty with me, please listen to that revision rhinoplasty podcast about, what it is to sign up for that process of having your nose revised. It's a big deal. But yeah, I mean, those are the things that come up for me. I mean, we do get some infections. Like I had to send a guy for an infectious disease consult after he'd had 6 rhinoplasties or something like that. And, they charged him for it. I said, I don't know what to tell you. Like, you've got an infection. It's a risk of surgery. It happens in, 0.01% of primary rhinoplasties. And there's data out of Australia and Korea that says it's like 2.3% of revision rhinoplasties with ribs. So again, you do 100 of them, 2 people are having a problem that you need to get antibiotics. So like that happens. The key is to know about it before surgery. That as you're listening to this podcast, you're going to sign up for surgery saying like, well, I guess I should really look into like, what are the risks of these things? Because they're low, they're infrequent, and they're manageable, but they do happen to somebody.
And you have to have that back burner knowledge, because it may be an out-of-pocket fee for you. Like I said, I have CosmetiSure. Some plastic surgeons don't. They say you have a problem, you have a hematoma, you're paying for OR anesthesia, no reimbursements, that's it. Or you're paying for a new implant, that's it. And so you have to expect that you may be out another couple, $3,000, $4,000, $5,000, $6,000.
That's right.
If you have a complication, and that needs to be sort of in your budget to be addressed.
And it sucks for us too. Like, we don't like complications. We take them home with us. We're upset the whole time. Like it's disconcerting. Yeah. Yeah. And so we're not having fun either. Like it sucks. We want our patients to have the ultimate aesthetic surgery experience. We want them to go through it. We want them not to have any pain. We want them to get a great result and tell all their friends. Complications to us are like
they're the worst.
It's just like the bitter pill you have to swallow if you're going to do aesthetic surgery.
Right.
Y-
Yeah.
We have to. It's part of
Yeah.
how we do this.
Yeah, there's nothing worse than knowing that your patient is out there and upset and going through a rough time. It really,
Sucks.
I hate that part about it. But, I do commit to being there for the patients,
That's
and
right.
we're going to get you through it. And no matter what, we will be there and we'll get through this together. Now, there are the complications which you addressed before, which happen outside of that 30 or 90-day window, which are things like for the breast surgeries, capsular contracture or implant
Ugh, the
malposition,
worst.
or for in your case with the rhinoplasties, maybe some revision rhinoplasties. So these are things that what I typically have my patients sign is a revision policy agreement that there are potential revisions that may happen in the future, depending on the severity of it. You may have to pay an entire surgical fee,
You might.
including OR, anesthesia, surgeon's fee. Or if it's something that I feel, doesn't require a surgeon's fee, then maybe you won't have to pay that. So there's some leeway to it. If you have a capsular contracture, a lot of the implant companies will comp, some money, or they'll give you another pair of implants. So there are definitely some things which can be addressed financially down the road, but sometimes they're not. Sometimes you may be on the line for that revision.
Yeah, and you have to be prepared for that. And
You
that's
just
why
have
we're
to.
that's why we're having this discussion. And by the way, when problems happen, like, we get that you're upset, and we don't like it. But you don't need to go into asshole mode over it, because like that isn't helpful. We get it's frustrating.
Yes.
Like
We're frustrated too.
We're frustrated too. And we're doing everything that we can to care for you. So like the attitude like that we suck isn't really helpful it's not conducive to everybody getting on the same page and getting through the problem. And I don't know why that's the choice of some patients, other than that there was like, because I try not to operate on those patients. I really try not to, but I think some of them kind of sneak through the cracks, and then like all of a sudden you have a problem, and
there
now
it
you
is.
got like
Yeah.
a problem and an asshole that you have to take care of, and that's not fun, and it's not
really
not
hard.
helpful.
It's really hard, and the problem too is that there's a lack of insight. Those particular patients don't always realize
Right.
that they are that patient, but it makes it really
It's so bad.
hard to take care of patients that are angry, because
They're fighting you.
The feeling permeates the staff. You see the name on the schedule for the day, and the whole staff just goes, oh. And then when they come in, the whole energy changes, and everyone's uptight and anxious because things have just gotten really, really negative.
Yeah.
And
Not helpful.
It's not
It's
helpful.
just not helpful to making the problem go away.
No.
It's not helpful to getting through it. By the way, if anybody is at home wondering if they're that person, just call in. We'll tell you. We're very honest about it. Just give a call. You could probably speak to Jenny. She's
She'll be
she's
like, "Yep,
pretty quick.
yeah, you're on
Yes,
the
you're
list."
that. You are on that list. You are that one. And it's not many, by the way. It's not
No,
many.
thank
So
goodness.
thank God it's not many.
There's like one or two. Like it's very few and far between.
And thank God that
goodness.
not many people have problems. 95% of the time, we are dealing with happy patients that are like, high five, what's my next thing? I'm sending my friends. This is great. The complications they just pour water on the fire of how excited people are about their plastic surgery experience. And it sucks. And we do this knowing that, and you have surgery as patients knowing that. So if it comes up, we have to deal with it. Get on the same page so that we can all make it work, and we'll get you through it. We don't
Yes. Yes,
like
yes,
say,
yes.
oh, too bad for you. Go see somebody else.
No.
Which, by the way, people do.
No.
Don't mention any. We have stories galore
no,
about
no.
that, by the way.
No, we own it. We own our patients.
We own our patients, but there are surgeons that'll be like, yeah, that's really too bad. Let me give you a guy's name down the street and go see him, and he'll take care of it. Right? I mean, that's happened.
Yeah, I get those ER calls.
You do. No names. We have that list also, by the way. You can call in and say the name, and then we'll either say, no, that's not one, or we'll just say nothing. But it's bizarre that there are surgeons that'll just be like, yeah, that's really too bad. Listen, go to the emergency room, see if they can find somebody and help you out. And that is 100% true that happens.
Oh yeah.
People tell me those stories. now back to the deaths column of the complications issue.
Okay, yes.
Because I wanted, and I'm not going to name the country because I have a lot of good friends there. But like I went to some cosmetic surgery conference, and I'm not even going to say where it is, but let's say it's south of Texas. And like it might be really, really south, like to Antarctica, and it might be just south of Texas. But I noticed, and like we go to ASAPs all the time. I'm going to ask you this, you just tell me, how many times do you see like a specific column for deaths in complications when talking about rhinoplasty or breast augmentation or liposuction? How often at ASAPs is there a column? It's because it might say seromas, hematomas, because those happen pretty frequently. Yeah. They're if you're going to have a complication, those are things that come up and we take care of them. No big deal. But deaths as an individual column with numbers in it.
Yeah, that's not a thing.
It's not a thing. Conference that I was at, it was a thing.
Oh, wow.
Like in a lot of the presentations.
Wow.
And I kind of was like, excuse me, I have a question.
I have a concern.
Why is deaths a column on these presentations about liposuction? Oh, they're like, well, that happens here.
Wow.
Like a lot.
That's scary.
And I'm not going to say where. I don't want to say anything about, I don't want to name names. I don't want to do anything. But it was like, I came back and I remember because I was like, what is going on in the rest of this portion of the world that this is part of doing aesthetic surgery?
Well, that's why we would, again, refer you back to the plastic surgery tourism podcast and take a listen to that one and just be careful.
Just be careful.
And be careful with plastic surgery tourism in Los Angeles as well.
Yeah. No,
do your homework there.
Do your homework.
I mean, we did that whole thing with the botched butts and what happens when you go to back alleys and, non-licensed practitioners. It can definitely happen. So
sometimes people go to, and this is really what I see a lot in rhinoplasty, is they'll go to people that are, oh my God, they're so incredible. They're all over the internet, blah, 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 blah. And they really wind up in the office of the best marketer.
Yeah.
Not necessarily the best surgeon. And, I'm not saying who the best surgeon is or anything like that, but we're going to do a little podcast about that. But I'm saying that you got to really know where you're going. You got to know that who you're going to is a board certified plastic surgeon that has, great experience in what they're doing and that you can see the before and afters on their website or their Instagram or whatever, and that you have the confidence that you're in the right place. Because if you're not, then when you do have a complication, there may not be somebody there who can handle it.
That is true. That is very true.
I'm going to refrain from telling my story about a practitioner that wants to, quote unquote, add liposuction to their practice.
Oh, yes.
And I use the term practitioner for a reason, but I'm just not going to tell that story. I can't.
No, not this time around.
I literally and actually can't even. I won't even.
I won't
even, because it's brutal. So like if I tell it, then people just, they'll be blown out of the water of like what's possible out there. And I'm telling you, it just makes you want to say, please look at the board certification and make sure that they do this procedure.
Yes.
And how can you really confirm that the surgeon that you are going to is qualified to do that operation? You can ask them, do you have hospital privileges to do this operation?
It's the simplest question you can ask, and it
tells
you
it tells you everything.
Because it sounds kind of dumb, actually, and when I was going through stuff as a patient, I didn't really get it. But here's the deal. Hospitals, especially in an urban area, will not grant a surgeon privileges if they have not received the training for those procedures.
That's
and they
right.
go through your training. Where did they collect, and it takes them 6 months to go through this. Where did you get your medical school degree? They want the diploma. Where did you do your internship, your residency, your fellowship? How many procedures have you done?
Yep.
And after they've gone through that and verified and contacted your graduating departments, only then do they grant you privileges to do these kinds of cases, X, Y, and Z at this hospital. And so if your surgeon says, yeah, I have privileges to do that at Cedars, at St. John's, at Hollywood Press, wherever, well, then they did the training required to do those procedures.
Definitely.
But if they only have privileges at some outpatient surgery center in their office and no hospital privileges, that's a big red flag.
Yeah, it is. And this is where, like, there are other specialties, and no offense to those other specialties, we need all of them, but they do these weekend courses to now become, weekend plastic surgeons.
Yeah.
And they don't have hospital privileges. I mean, if you're in internal medicine, you're not going to be able to get privileges to do liposuction at Cedars-Sinai Hospital. They just aren't going to give it to you. When they call your math teacher on their background check, which they do from 8th grade, and they say, did this person get training for liposuction? No, but the internist is great at managing like hepatitis and things like that. But that's their specialty. But some doctors are trying to cross over into the cosmetics because it pays well and there's cash, et cetera, that they can make in addition to whatever it is that they do. And quite honestly, I think that you really want to be with a surgeon that's board certified in plastic surgery. It just makes it easier if you're getting rhinoplasty and facelifts than board certified facial plastic surgeons. Yeah. After that, I'm not sure who's doing your operation, and I don't know what kind of training they have.
Yeah, all that is just to go and say that, if a complication happens, that you want someone who knows how to take care of it. That's what it comes down to.
And we can do that, even though we don't like it.
Yes.
And we don't want you to be nasty about it.
But we will do it.
We will do it.
We'll do it.
And just please be nice, because we have very fragile egos.
True.
It's true. It
doesn't take much.
Yeah, we it just sucks when it really hurts my soul when my patient's struggling.
Agree.
It really does. And I don't like it when I see them having a hard time. And because these are uplifting operations, and they really and when they go well, I mean, I had a husband and a wife just basically say, like, what you've done for us has changed our lives. And it was like this moment that you're like, oh my God, like that's so great. They're like, you have no idea. And they they'll probably tell us most of the time, like, you did a great job or whatever. But when they really kind of like look at what's they've gotten out of their plastic surgery, it's tremendous.
Yeah, those stories are great, and we love them, and that's why we do them. If that's not the story and there's a complication, that's okay. We'll hold your hand and we'll walk you through to the other side, and we will get it to where it needs to be.
That's right.
That is the deal.
That is our commitment. That's what we do. And thank you very much for playing.
And this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.